Good afternoon, ladies and gentlemen. This is somewhat of a surreal experience talking to a computer screen, but I hope this will all work and I hope everybody can hear me. So, first of all, thank you very much for joining Antibiotic Research UK's virtual 2020 annual lecture, which this year is to be given by Professor Alison Holmes of Imperial College, and I'm very much looking forward to what she has to say. My name is Colin Garner, and I'm the charity's chief executive. None of us who were at last year's annual lecture at the Royal College of Pathologists had any inkling that this year's lecture would have to be virtual because of the COVID pandemic. We are in the middle of the world's worst health crisis for 100 years, and no one knows how this pandemic will play out. But what we do know is that hospitalized COVID-19 patients are not only having to fight off the virus, but for some of them, they pick up a secondary bacterial infection, almost a double whammy, and they're having to fight off the secondary bacterial infection. It's too early to say how frequently these secondary bacterial infections occur and whether they respond to antibiotics or not. However, owing to the possibility that patients can get sepsis from their pneumonia, empiric antibiotic treatment is often given despite the fact that guidances recommend against this practice. Now, our charity is focused on antibiotic-resistant bacterial infections, and many of us thought that these might be responsible for a global pandemic. Already in some parts of the world, antibiotic-resistant infections have reached epidemic proportions, and our concern is that unlike with a virus where vaccines might hopefully be developed, and for COVID hopefully soon, for many bacterial infections, the only treatment is antibiotics. And as these become less effective, we will start to run out of treatment options. And that is why our charity is focused on this area. Our charity is taking a holistic approach to the problem of drug-resistant infections with its various programs. Next slide, please. So in terms of what the charity's goals are, we are looking into researching new antibiotic treatments, and you'll hear more about that shortly from Professor Chris Dowson. We are also carrying out educational activities, and you'll hear more about that later from Christine Bond, and patient services, and you'll hear more about that from Arlene Braley. This is the today's meeting program, and I think everybody's received a copy of this. I won't run through it, but you see that we have a packed program, and we'll try and stick as well as we can to time. Next slide, please. So, as a charity, we rely on public donations and we rely on funding from people like yourselves. So, if you take a camera shot of this barcode, it will automatically take money out of your bank account. So please do take a camera shot of the barcode, and this will help support our charity. Next slide, please. Right. So we have various activities coming up, which I want to make you aware of. After about 3 or 4 years of trying, we have been successful in obtaining a BBC Radio 4 appeal. And that Radio 4 appeal will be on Sunday, November the 1st at 7:54. So please listen. Please tell all your friends, colleagues and relations about the appeal. It's the first time we've had such national coverage as a charity. The presenter is a very interesting gentleman, Dr. Adam Rutherford, who I'm sure many of you will know from his programs on the radio in particular. And he talks very movingly about his own experiences, not only with COVID, but also getting a bacterial infection. Next slide, please. This is the time of the year where World AMR Awareness Week occurs in November. And in the past, we've asked everybody to carry out Great British Tea Parties in their homes, in their communities, in their workplaces. This year, of course, that becomes almost impossible to do. So we've got various virtual ways of raising money during the World AMR Awareness Week. And if you please go to our website, you will be able to see exactly what you're able to do. Next slide, please. One particular innovative way that we are getting involved with this year is the Great University Science Quiz, which is going to be held on the 18th of November, 7 o'clock, where competing universities will, undergraduates at those universities, will compete against each other in a science quiz, some of the rounds of which are based around AMR. I believe up to 25 universities have so far signed up to this. And we're very pleased that 2 pharmaceutical companies, Shionogi and Merck Sharp and Dohme, have agreed to help sponsor this event. Next slide, please. So that's all I want to say at the outset, to say thank you for attending today. These are some of the many people that have raised money for this charity over the years, and we hope that we will get many others supporting us as we go forward. So I'm now going to hand over to Professor Chris Dowson, Trustee, Chair of Science Committee from the University of Warwick, who's going to talk more about our science programs. Thank you.